Hello, my name is Gretchen Whittington, and I will be discussing the National League of Nursing's 8 core competencies. The first competency is to facilitate learning. For this nurse competency, nurse educators are responsible for creating an environment in the classroom, laboratory, and clinical settings that facilitates student learning and the achievement of desired cognitive, affective, and psychomotor outcomes. I feel that I've met this requirement with my diabetes solutions class by providing a safe, clean environment that has plenty of room and air movement. I encourage my students to ask questions when they have them. I allow them to get up and stretch and go to the bathroom if needed. I provide drinks and snack for everyone. I ask questions that will encourage discussion in the class. I encourage my students to share their own experiences. I let them know that my goal is for them to have access or information to help them manage their diabetes. Competency 2 is to facilitate the learner development and socialization. Nurse educators are to recognize their responsibility for helping students develop as nurses and integrate the values and behaviors expected of those who fulfill that role. I will try and relate this to my diabetic patients and/or students. They are not forced to come to my class, and it is just a recommendation by their healthcare provider to help in the treatment and management of their diabetes. Education is key. I go around the room and I have everyone introduce themselves and ask them to share their diabetic journey and family history. This is a good groundbreaker that usually gets everyone active and involved. Competency 3 is the use of assessment and evaluation strategies. Nurse educators use a variety of strategies to assess and evaluate student learning in the classroom, laboratory, and clinical settings, as well as domains of learning. I present all of my students with a pre-test and a post-test. Oftentimes that scares people, and I reassure them that I am just evaluating the knowledge that they have coming into the class, and that we will go over the post-test to see what they have learned and to help them understand what they didn't. I also have my students fill out a form so that the dietitian can calculate their BMI, which will then tell them how many carbohydrates they need to consume to either maintain weight or to lose weight if needed. I like this because I've learned that the diabetic diet is something that everyone should follow. They can still have dessert if they wish. It is just understanding portion sizes and proper eating using the My Plate plan. Competency 4 is participation in curriculum design and evaluation of program outcomes. Nurse educators are responsible for formulating programs outcomes and designing curricula that reflect contemporary healthcare trends and prepare graduates to function effectively in the healthcare environment. I collaborate with all educators in my program, and we have tailored it to try to touch on all important topics. As with anything, in medications, treatments, and in evidence-based practice, everything continues to evolve. We update accordingly and must all complete 15 hours a year of continuing education. We conduct follow-up calls on 1 and 3 months after attending the class to check how they are doing and see if they have any questions or concerns. Competency 5 is to function as a change agent and leader. Nurse educators function as change agent and leaders to create a preferred future for nursing education and nursing practice. I collaborate with Hayes Med, the University of Kansas, as well as the American Diabetic Association to provide the most up-to-date, accurate information. We all take our experience as teachers and implement different strategies to keep people engaged and ready to learn. Competency 6 is to pursue continuous quality improvements in the nurse educator role. Nurse educators recognize that their role is multidimensional and that an ongoing commitment to develop and maintain competence is an essential role. I try to read evidence-based articles and complete continuing education models to stay current on diabetes. I've gone to Hayes Med and sat in on classes trying to learn from other patient educators. I've always felt that the more that I learn, the more I realize that I don't know. I think education is never ending and constantly evolving. Competency 7 is to engage in scholarship. Nurse educators acknowledge that scholarship is an integral component of the faculty role and that teaching itself is a scholarly activity. When I first started this class and was to write about scholarship, what I've done in my teaching roles, I was like, I really don't have many of those attributes. I never really thought that teaching a new nurse how to work in the OR, PACU, or ambulatory surgery was me being a preceptor. I guess if we are doing our jobs correctly, we continue to learn and educate from others from our own experiences. I've been in nursing for 20 years and I feel like that I learn something new every day. Competency 8 is to function within the educational environment. Nurse educators are knowledgeable about the education environment with which they practice and recognize how political, institutional, social, and economic forces impact their role. I meet all different types of people while teaching my class. Diabetes does not discriminate due to race, religion, income, or anything else. Most people have been affected by diabetes, whether it be in a friend or a family. I treat everyone the same and try to find ways to help everyone live longer, healthier, happier lives. I continue to learn every day and work on each competency. I am sure I have room for improvement in all areas. I believe that there is no end to education and that learning is a lifelong process. Thank you.